Helen Evans, thanks for joining us and thanks for coming to Global Ideas Forum. It's been terrific having you here. You opened the forum talking about the health in the Asia Pacific region, and you mentioned that it was a dynamic region, growing in population and economics. What impacts is that having on the health of the region?
I mean, I think it has both positives and negatives. I mean, it is a really exciting region. The economic growth, global economic growth, has really moved west from traditional centres of Europe and North America. And so there's a lot of very fast growth here. And that brings all sorts of opportunities, increased funding for health, etc. But it also brings with it a lot of challenges, because in some of these countries the economy has grown fast because of commodities, but the infrastructure hasn't kept up. So the social infrastructure, so health, capacity of managers and leaders hasn't kept up with the economic growth. But it also provides opportunities, but I think it reinforces even more the need for collaboration across sectors. Governments on their own, national governments, always will and always should have a primary responsibility for the health of their population, but they can't do it on their own. And particularly some of the countries in this region where the skills and the capacity haven't grown with the economy, there's an even greater need for cross-sectoral collaboration with private sector and with civil society.
We've seen with the Ebola outbreak the importance of health for security, and I'm wondering if some of these dynamics have actually increased the potential risk of pandemics coming across borders in Asia Pacific.
Oh, indeed. I mean, we're incredibly mobile global populations, so I don't think any countries are immune. We all hop on aeroplanes, and that includes people in this region, hop on and off. And then when you don't have the infrastructure there, where you don't have the surveillance systems in place, where you don't have the emergency response in place, there is an increased risk indeed. I know there was a lot of concern, for instance, about Ebola and South China, because there's a huge access and a lot of flights between South China and Africa, and that was considered to be a real hot spot. But if, for instance, Ebola had come in Bangkok's a big transit point, Singapore's probably in a better position to cope, then it would have been a real problem. And so it's another reason why regionally we all need to work together to ensure that the surveillance systems, the data systems, the emergency response capacity is in place. And the unfortunate thing with epidemics or pandemics is that understandably national governments tend to look after their own first, and that can actually have a downside. I have to say that Australia's government's response, which was look after Australia first, which is understandable and the Australian population would want us to do, but I would have liked to have seen Australia more proactively responsive in terms of the needs of others, because we're all interconnected and we'll all either benefit or have disadvantages.
You touched on climate change as being one of the classic examples of how a growing population is putting additional pressures on the climate system, and that's having health impacts. What are some of the risks as well as the opportunities that climate change presents?
Well, I mean, there's some very, very concrete risks, for instance, with the changes in temperature. Some of the infectious diseases that countries thought had disappeared off their agenda are reappearing. So, for instance, for the first time in many years, as I understand it, there was endemic malaria in southern Italy. Now, they haven't had malaria there for a long time, but that's just a very specific example about climate change. But also with shortage of water, with less arable lands, there's a big move to urbanisation anyway, which in itself is a huge challenge, but that's going to be exacerbated movement of people with climate change. The advantage, I think, and it's interesting, the Lancet Commission put out a report earlier this year about health and climate change, and one of the things they said, which I found really interesting, and actually I agree with, is that the fact that it will impact on people's health makes it a very real problem for people. So there's a danger with climate change that it's, oh yes, it's out there, there's a lot of mixed views on it, and actually it's scientific, there's not much we can do about it. When people suddenly recognise that it may actually have a personal implication for them because of the health impact, then you may get a lot stronger general population response to climate change.
I understand you've been a passionate advocate for women and for women playing important roles in society, and I'm wondering if you might like to touch on your views on how we might empower women in order to improve health in our region.
I think that women have an absolutely key role to play, and maybe I'm biased, but in many countries, and many of the low-income countries, women are the primary income earners, and they're the absolute mainstay of families, and often they're the mainstay of communities. And if they don't have access to contraception, to family planning, if they don't have confidence that their children, when they have children, that they're going to survive, and if they're bowed down with endless childbearing, which impacts on their health. If they have children who are constantly sick, they are also the carers, so they have multiple responsibilities. If we can focus on the health of women and children, so that is less of a totally all-consuming concern, and if we can focus on girls' education, and that they all go together, there's actually quite a lot of literature that shows that when a mother dies in her childbearing years, that infants are more likely to die, but also it shows that the daughters in the family end up taking on the caring role, so they don't get the education. So you have this vicious cycle. If we can free that up, and the energy that women bring, then I think we will see progress right across.
Great. And what excites you the most about Global Ideas Forum?
What I find really exciting about Global Ideas Forum is that there's the young upcoming generation of energetic, committed, driven people across disciplines who aren't, I think, as tied down as perhaps my generation, which is the baby boomer generation, in sort of sectorial approaches, in keeping within your own domain because that's what you know and feel comfortable with. I think that Global Ideas Forum provides the opportunity for throwing around ideas across disciplines and across sectors, and combined with the enormous energy that I think younger people have, and they've got a much more open way of looking at it and problem solving.
Appreciate it. Thanks, Helen Evans, for joining us today.
My pleasure. Thank you.